The coffee you drink every morning could be quietly pushing your blood sugar higher before breakfast even begins. That does not mean coffee is poison, and it certainly does not mean every senior must give it up. But after 60, the difference between a protective daily ritual and a glucose problem can come down to 4 details. Most people never check sugar, serving size, timing, and your personal response to caffeine. Many older adults believe they are drinking a healthy cup of coffee. Yet inside that cup may be several teaspoons of added sugar, a heavily sweetened creamer, or a flavored syrup that turns an ordinary drink into a liquid dessert. Even black coffee can create a different problem in certain people. Caffeine may trigger stress hormones that tell the liver to release more glucose into the bloodstream. For a senior with insulin resistance, prediabetes, or type 2 diabetes, that temporary rise may be more noticeable. Here is what makes this so confusing. Studies have linked habitual coffee consumption with a lower long-term risk of developing type 2 diabetes. But controlled studies also suggest that caffeine can temporarily reduce insulin sensitivity and raise glucose after a meal in some people who already have diabetes. Both findings can be true. Coffee contains natural compounds that may support metabolic health over time, while caffeine can still produce an immediate glucose response in a sensitive body. Your neighbor may drink 2 cups and remain stable. You may drink 1 cup and see your glucose rise sharply. The label on the coffee cannot reveal which person you are. That is why the safest coffee habit after 65 is not based on headlines, trends, or miracle ingredients. It begins by examining what is actually in your cup and what happens inside your body afterward. During this video, you will learn how to prepare coffee without turning it into a sugar bomb. When decaffeinated coffee may be the wiser choice, which common breakfast combinations can worsen a spike, and how to perform a simple personal coffee test using your normal glucose monitoring routine. You may not need to abandon the morning ritual you love. You may simply need to change how you drink it. The wrong cup of coffee can make a senior's liver release sugar into the bloodstream, even when no sugar was added to the cup. To understand how this happens, imagine your bloodstream as a highway and glucose as the fuel traveling toward your cells. Insulin acts like a key, helping that fuel leave the blood and enter the muscles, brain, and other tissues where it can be used for energy. When the body responds well to insulin, glucose moves efficiently. When insulin resistance develops, those cellular doors become harder to open, so more glucose remains trapped in the bloodstream. This becomes increasingly important with age. Muscle tissue is one of the body's largest storage areas for glucose. As adults grow older, they may gradually lose muscle because of inactivity, illness, inadequate protein, or normal age-related changes. With less active muscle available to absorb glucose, the body may have greater difficulty controlling blood sugar after meals. At the same time, the liver continues performing one of its most important jobs. It stores glucose and releases it when the body needs energy, especially overnight and between meals. But caffeine can stimulate hormones such as adrenaline and cortisol. These hormones prepare the body to respond to stress by telling the liver to release additional glucose. Thousands of years ago, that response could provide immediate fuel for escaping danger. Today, the trigger may simply be a strong cup of coffee. The body does not always recognize the difference. In someone with good insulin sensitivity, the temporary glucose increase may be handled quickly. In someone with prediabetes or type 2 diabetes, insulin may not move that glucose into the cells efficiently. The result can be a higher reading, particularly when coffee is consumed with toast, pastries, sweet cereal, or another rapidly digested carbohydrate. This is why 2 cups that look identical can produce completely different reactions in 2 different seniors. One person may process caffeine quickly and experience little change. Another may remain sensitive to it for hours. Genetics, liver function, sleep quality, medication, use, smoking history, body composition, and the amount of coffee consumed can all influence the response. Poor sleep adds another layer to the problem. Coffee consumed too late in the day may reduce sleep quality, even when a person believes it does not prevent them from falling asleep. Deep restorative sleep plays an important role in glucose regulation. A senior may drink afternoon coffee to fight fatigue, sleep poorly that night, wake up more insulin resistant, and then depend on more coffee the following day. What appears to be an energy solution can quietly become a metabolic cycle. But coffee itself is more complicated than caffeine alone. Coffee contains hundreds of natural compounds, including chlorogenic acids and other antioxidants. Researchers believe some of these compounds may influence inflammation, liver metabolism, gut bacteria, and the way glucose is processed. This may help explain why people who regularly drink coffee have often shown lower rates of type 2 diabetes in long-term population studies. However, those studies do not prove that coffee prevents diabetes. Coffee drinkers may differ from non-coffee drinkers in many ways, and an association cannot guarantee that the beverage caused the result. It would be dangerous to tell a senior to start drinking several cups of coffee as a diabetes treatment. The difference between short-term and long-term effects is essential. Caffeine may temporarily raise glucose or reduce insulin sensitivity in certain people, while other coffee compounds may be associated with potential benefits over many years. Decaffeinated coffee also contains many of these non-caffeine compounds, which is why it may be worth considering when ordinary coffee causes shakiness, palpitations, poor sleep, or repeated glucose elevations. Preparation can easily overpower any possible benefit. A plain cup of coffee contains very little carbohydrate. Add flavored cream or syrup, whipped topping, or several spoonfuls of sugar, and the metabolic picture changes immediately. The drink may still be called coffee, but the body may respond to it more like a dessert. This is the truth every senior should remember. Coffee cannot be labeled universally good or bad for blood sugar. Its effect depends on the person, the caffeine dose, the ingredients, the timing, the accompanying food, and the body's current ability to respond to insulin. The most reliable answer will not come from a dramatic headline. It will come from observing your own body, carefully protecting your sleep, measuring what you add, and discussing unusual glucose changes with the healthcare professional managing your diabetes. The coffee mistake most likely to sabotage a senior's blood sugar may be sitting in the refrigerator door, disguised as creamer. Many people carefully avoid soda candy and desserts, yet pour a sweetened coffee creamer into their cup every morning without measuring it. The label may list a small serving, but an ordinary pour can easily contain 2, 3, or even 4 servings. Flavored syrups, whipped toppings, caramel drizzles, and sweet foam can add even more rapidly absorbed carbohydrate. By the time the cup is finished, a drink that began with almost no carbohydrate may deliver as much sugar as a dessert. The second hidden mistake is believing that sugar-free automatically means harmless. Some sugar-free creamers still contain carbohydrates, highly processed fats, or ingredients that may affect appetite and digestion differently from person to person. Certain sweeteners can also cause bloating or diarrhea. The safest approach is not to trust the largest words on the front of the package. Read the serving size, total carbohydrate, added sugar, and ingredient list. Then measure what actually goes into the cup. A third mistake is drinking strong coffee immediately after waking, especially following a poor night of sleep. Cortisol naturally rises in the morning to help the body become alert. Caffeine can add another stimulating signal. In a sensitive person, this combination may encourage the liver to release more glucose. That does not mean everyone must delay coffee, but seniors who repeatedly notice high morning readings should compare what happens on days with coffee, decaf, and no coffee before drawing conclusions. The fourth mistake is using coffee as a substitute for breakfast. A senior may drink 2 cups, feel less hungry, and postpone food for several hours. Later, intense hunger can lead to oversized portions, sweet snacks, or refined carbohydrates. For someone taking insulin or certain glucose-lowering medications, skipping or delaying a meal may also increase the risk of low blood sugar. Coffee should never be used to override a medication plan or suppress hunger without medical guidance. The fifth mistake is pairing coffee with foods that digest very quickly. Sweet rolls, donuts, white toast with jam, sugary cereal, and large muffins can cause glucose to rise rapidly. Caffeine may intensify that response in some people. A more balanced meal containing protein, fiber, and healthy fat is usually digested more slowly. Eggs with vegetables, plain yogurt with nuts, or oatmeal with seeds may create a steadier response than coffee beside a pastry, although individual needs and medication plans vary. The sixth mistake is assuming that a larger cup is simply more hydration. Coffee sizes have expanded dramatically, and 1 mug may hold far more caffeine than expected. Caffeine content also varies by bean brewing method and strength. A senior who tolerates a small homebrewed cup may experience trembling palpitations, anxiety reflux, or a glucose increase after a large cafe drink. More coffee does not create more protection, and the general adult caffeine limit should never be treated as a daily goal. The seventh and most important mistake is ignoring the body's evidence. Many seniors repeat the same coffee routine for years without checking whether it affects their readings. A simple comparison can be revealing. On several typical mornings, record glucose before coffee, and again at the time recommended by your diabetes care professional. Keep the meal activity and coffee amount as consistent as possible. On separate days, compare plain caffeinated coffee with decaf or a smaller serving. One unusual reading proves very little, but a repeated pattern deserves attention. Never change insulin or medication because of an online video or a single glucose result. Contact your healthcare professional if readings are repeatedly outside your target range, or if coffee is followed by severe weakness, confusion, chest discomfort, fainting, or a racing or irregular heartbeat. The purpose of monitoring is not to make you afraid of coffee. It is to remove the guesswork. Once these hidden mistakes are visible, the morning cup becomes easier to control. The best coffee habit is not the one promoted by a celebrity, cafe, or wellness trend. It is the one that contains no hidden sugar, respects your sleep and medications, and produces a stable response in your own body. The safest way for seniors to drink coffee for better blood sugar control begins by removing the ingredients that make coffee behave like candy. Start with the simplest version of the drink. Plain brewed coffee contains very little carbohydrate, but the moment sugar-flavored creamer, syrup sweetened, condensed milk, or whipped topping enters the cup, the glucose effect can change dramatically. The first rule is not to guess. Measure every ingredient for at least 1 week. A casual splash can be much larger than the serving size printed on the label. For many seniors, the best starting point is a small or moderate cup of plain coffee with no added sugar. If the taste is too bitter, reduce sweetness gradually, rather than trying to change everything overnight. Someone who normally uses 3 teaspoons of sugar might begin with 2, then 1, allowing the palate time to adjust. Cinnamon can add aroma without adding meaningful sugar, although it should never be promoted as a cure or replacement for medication. Milk can be used, but the type and amount matter. Regular milk contains natural carbohydrate. Sweetened plant-based milks may contain even more. Unsweetened versions usually provide less added sugar, but labels vary widely. A measured tablespoon or 2 may be easier to manage than pouring directly from the container. The goal is not to create a perfect cup. It is to create a predictable one. Protein and fiber can also change the way the entire morning meal affects glucose. Coffee consumed beside eggs, vegetables, plain Greek yogurt, nuts, seeds, or a carefully portioned bowl of oatmeal may produce a steadier response than coffee consumed with a pastry, sweet cereal, or white bread covered in jam. This does not mean every senior needs the same breakfast. Kidney disease, swallowing difficulties, allergies, appetite loss, and medication schedules can all affect what is appropriate. Hydration is another part of the protocol. Coffee contributes fluid, but it should not become the only drink consumed during the morning. Older adults may not feel thirst as strongly as younger people, and dehydration can contribute to dizziness, weakness, constipation, and more concentrated glucose readings. A glass of water before or alongside coffee creates a simple routine that supports hydration without requiring an expensive supplement. The amount of caffeine deserves equal attention. A large mug can contain far more caffeine than a small cup, especially when the coffee is strongly brewed. Seniors who experience trembling anxiety, palpitations, reflux, headaches, or poor sleep should not assume these symptoms are an unavoidable part of aging. They may be signs that the caffeine dose is too high. Decaffeinated coffee can be a useful option because it retains many of coffee's natural non-caffeine compounds. It is not completely caffeine-free, but it usually contains much less. A senior who enjoys the flavor and ritual but notices repeated glucose elevations after caffeinated coffee may compare a similar amount of decaf on another day. The comparison should be made without changing several other factors at the same time. Timing matters as well. Drinking coffee with or after a balanced breakfast may feel steadier for some people than drinking it alone while fasting. Others may see no meaningful difference. The goal is not to impose one universal schedule, The goal is to identify the routine that produces the most stable readings, the fewest symptoms, and the best sleep. A practical personal test can help. On several ordinary mornings, keep breakfast activity and coffee size as similar as possible. Check glucose according to the monitoring schedule recommended by your healthcare professional. Record whether the coffee was caffeinated or decaffeinated, what was added, and how you felt afterward. Look for repeated patterns rather than reacting to one isolated number. Never use coffee cinnamon vinegar supplements or any other natural ingredient as a substitute for prescribed diabetes treatment. Do not change insulin or medication doses without professional guidance. Seniors taking medicines that can cause hypoglycemia must be especially cautious about skipping meals or using coffee to suppress appetite. The most effective coffee protocol is not dramatic. It is plain, measured, repeatable, and personalized. Keep the portion reasonable. Remove hidden sugar. Pair the drink with nourishing food when appropriate. Protect hydration. Consider decaf when caffeine causes problems. Then let your own glucose pattern symptoms sleep. Quality and medical guidance determine whether that morning cup truly belongs in your routine. A senior can prepare the perfect cup of coffee and still lose blood sugar control by sitting still for the next 3 hours. Coffee is only one part of the morning equation. What happens after the cup may matter just as much as what goes into it. Aging muscles can become less efficient at removing glucose from the bloodstream, especially when they are rarely challenged. The encouraging news is that muscle contractions can help pull glucose into the cells, even when insulin is not working as effectively as it once did. That is why a brief walk after breakfast can be so valuable. It does not need to be fast, exhausting, or painful. For many older adults, 10 to 15 minutes of comfortable movement after eating may support a steadier post-meal glucose response. Walking through the home, moving along a hallway, or carefully stepping in place near a stable counter may be enough to interrupt prolonged sitting. Safety must come first. Seniors with balance problems, severe neuropathy, chest discomfort, shortness of breath, foot wounds, or a history of falls should ask a qualified healthcare professional. What type of activity is appropriate? Anyone using insulin or medication that can cause hypoglycemia should understand how exercise may affect glucose and should follow their clinician's monitoring instructions. Timing your coffee can also protect the rest of the day. Caffeine may remain active in the body for many hours, and its effects can last longer in some older adults. An afternoon cup may seem harmless because it does not stop you from falling asleep. Yet it can reduce sleep depth, increase nighttime awakening, or leave you feeling less restored in the morning. Poor sleep can make the body less responsive to insulin the following day. It may also increase hunger, intensify cravings for refined carbohydrates, and encourage another large dose of caffeine. The habit can become a loop. Coffee is used to fight fatigue. Late caffeine weakens sleep. Poor sleep worsens glucose regulation, and greater fatigue leads to more coffee. A practical approach is to keep caffeinated coffee earlier in the day and observe what happens when afternoon coffee is replaced with decaf, herbal tea, or water. There is no single cutoff time that works for everyone. Your bedtime caffeine sensitivity medications and sleep quality all matter. The correct timing is the one that lets you enjoy the drink without stealing restorative sleep. Strength training provides another powerful form of support. Muscle is not merely responsible for movement. It is metabolically active tissue that stores and uses glucose. Age-related muscle loss can reduce this storage capacity, but seniors may still gain strength and improve function with appropriately designed resistance exercise. This does not require lifting heavy weights. Depending on physical ability, useful movements may include rising from a sturdy chair, performing gentle wall push-ups, using light resistance bands, or carrying safe household objects. Even small improvements in muscle function may help with walking balance daily tasks and glucose management. A physical therapist or trained exercise professional can adapt movements for painful joints, limited mobility, or fall risk. Breaking up long periods of sitting is equally important. A person may complete one morning walk and then remain seated for most of the day. Consider standing or moving briefly at regular intervals when it is safe to do so. Walk to another room, perform a few controlled heel raises while holding support, or complete gentle seated leg movements. Consistency is more important than intensity. Meal regularity also supports a predictable coffee routine. Drinking coffee at different times while skipping meals can make it difficult to understand what is affecting glucose. A more consistent schedule helps reveal whether the issue is caffeine, food, medication timing, poor sleep, stress, or inactivity. Hydration should remain visible throughout the day. Keep water within easy reach and drink regularly, unless a healthcare professional has prescribed fluid restriction for heart or kidney disease. Do not wait until intense thirst appears. Dry mouth, dizziness, dark urine, constipation, and unusual fatigue may signal that fluid intake deserves attention, although these symptoms can have other causes. The most powerful coffee habit after 65 may therefore have little to do with coffee itself. It is the routine surrounding the cup, a balanced meal, a measured serving, a short, safe walk, stronger muscles, regular hydration, and protected sleep. Coffee cannot erase the effects of inactivity, chronic sleep loss, or an unbalanced diet. But when it becomes part of a thoughtful daily rhythm instead of a rescue for exhaustion, seniors can preserve the pleasure of the ritual while giving their bodies a better chance to manage glucose steadily. The coffee habit, meant to help control blood sugar, can become dangerous when it hides a medication reaction, an irregular heartbeat, or a true diabetic emergency. This is why smart prevention requires more than choosing black coffee instead of sugar. It requires knowing when coffee is no longer a nutrition question and has become a medical concern. Begin with the heart. Caffeine stimulates the nervous system and may temporarily increase heart rate or blood pressure. Many people tolerate that effect without difficulty, but some older adults experience pounding, fluttering, skipped beats, chest pressure, trembling, or sudden anxiety. These symptoms should not be dismissed as normal aging. Stop drinking the coffee and seek urgent medical help if chest discomfort is severe. Breathing becomes difficult. Fainting occurs, or a rapid or irregular heartbeat does not settle. Coffee should never be used to push through unexplained weakness, dizziness, or chest symptoms. Blood pressure deserves careful attention as well. A senior may have a normal reading before coffee and a noticeably higher reading afterward. One temporary increase does not prove that coffee is unsafe, but a repeated pattern should be discussed with a healthcare professional. This is especially important for anyone with uncontrolled hypertension, previous stroke, heart disease, or multiple cardiovascular medications. Medication interactions can be easy to miss because caffeine is treated like an ordinary food ingredient. It is still a stimulant, and it may interact with certain heart medicines, asthma treatments, antibiotics, stimulants, and other drugs or supplements. Coffee may also change how quickly some medicines are absorbed when they are taken together. Never stop a prescription because of something heard online. Bring a complete list of medicines, vitamins, herbal products, and caffeinated drinks to a pharmacist or medical appointment. Ask whether coffee should be separated from any medication and whether the recommended limit needs to be lower for your condition. Seniors taking insulin or medicines that can cause hypoglycemia face another concern. Shaking, sweating, nervousness, a racing heart, weakness, and confusion may be blamed on strong coffee, but they can also be signs of dangerously low blood sugar. Caffeine may make the sensations harder to interpret. When these symptoms appear, check glucose immediately when possible, and follow the hypoglycemia treatment plan provided by your healthcare team. Do not assume that another cup of coffee will restore energy. Coffee does not contain enough fast-acting carbohydrate to treat low blood sugar unless large amounts of sugar have been added, and using a sweetened drink without checking may create another problem later. High blood sugar can also produce fatigue, thirst, blurred vision, frequent urination, and difficulty concentrating. These signs may develop gradually and be mistaken for dehydration, poor sleep, or aging. Repeated readings above your target range deserve professional evaluation even when you feel well. Coffee can aggravate acid reflux, stomach irritation, urinary urgency, or sleep disruption in certain people. Decaf, a smaller serving, drinking coffee with food or avoiding it later in the day may help. But persistent pain, vomiting, black stools, unexplained weight loss, or difficulty swallowing requires medical attention rather than another home remedy. Kidney disease and heart failure create additional considerations. Some people with these conditions are given specific instructions about fluid, potassium, blood pressure, or medication timing. General internet advice about drinking more water or adding milk to coffee may not fit their medical plan. Glucose monitoring should be used as a learning tool, not a source of fear. Record the coffee, type serving size, additions meal, activity, sleep medication timing, and glucose response. Several consistent observations are more useful than one surprising number. The United States Food and Drug Administration cites 400 milligrams of caffeine per day as an amount not generally associated with harmful effects for most adults. That number is not a recommended dose, and it is not a guarantee of safety for every senior. Individual sensitivity and the speed at which caffeine leaves the body vary widely. Your safe amount may be 1 small cup half-caffeinated coffee decaf, or none at all. The wisest choice is the one that keeps your glucose heart rhythm, blood pressure, sleep, and medications working together rather than against one another. Coffee should remain a pleasure, not a medical experiment performed without supervision. The most dangerous coffee mistake after 65 is believing one daily cup can protect you while the rest of your habits quietly damage your blood sugar. Coffee is not a cure for diabetes. It cannot replace prescribed medication, regular glucose checks, nourishing food, movement, restorative sleep, or professional medical care. But it also does not need to become another pleasure you surrender simply because you are getting older. The goal is not fear. The goal is control. Choose a modest serving. Remove hidden sugar. Measure the milk or creamer instead of pouring freely. Consider decaf. If caffeine raises your glucose, disturbs your sleep, or makes your heart race, pair your coffee with a balanced meal. When that fits your treatment plan, drink water during the morning and move safely after eating whenever your body allows. Most importantly, stop copying another person's coffee routine. Your friend may tolerate 2 strong cups. Your body may respond better to 1 small cup half-caffeinated coffee or decaf. The safest answer is found through repeated observation, not internet promises. For the next 7 days, write down what you drink, what you add, when you drink it, what you eat with it, and how your glucose responds according to the monitoring plan given by your healthcare professional. Look for patterns. One unusual reading is not a verdict, but repeated changes can give you valuable information to discuss with your doctor, diabetes educator, or pharmacist. Growing older does not mean losing every ritual that brings comfort. It means becoming more precise about which habits still serve your body and which ones need to change. Your morning coffee can remain warm, familiar, and deeply satisfying. Let it become a reminder that prevention is not built on one miracle ingredient. It is built on small decisions repeated with care. If this message could help another senior protect their independence, share this video with them. Subscribe to Seniors Hub 65 and tell us in the comments, do you drink regular coffee, decaf, or no coffee at all? Your cup should work with your health, never against